So, Amil, you're pregnant with your second child. You have a toddler at home, and we're in the middle of a pandemic. Talk to me about where your head is at. How are you feeling right now?
To be honest, it really shifts every day. I think like most people, I'm trying to just concentrate on getting through the day, keeping myself and my family safe.
This is Amil Niazi. She's a journalist based in Toronto, and you might remember her from the last time we talked to her on the podcast about millennials being the burnout generation. Today, we're having her back for a completely different reason, to talk about what it's like to be pregnant during the COVID-19 pandemic. I'm Tamara Kendacker, and you're listening to Wait, There's More.
Apologies, I'm getting a bit emotional now, but, it's not... It's not an easy time to be a parent. It's not an easy time to be expecting a new child. I think any woman that's going through this, any family that's going through this, is thinking about the world that our children are being born into. They're thinking about all the unknowns that are still so present for all of us, but particularly when you're pregnant, you're really in the dark. You're sort of fumbling around and hoping for the best. And I think that this situation can be paralyzing at times. I dread what lies ahead at the same time that I'm trying to be optimistic. And what's really sad is that, it's supposed to be a very joyful time. And I think that's what's really being missed, is just that joy of expecting a new life is gone.
How far along are you right now in your pregnancy?
I'm just over 31 weeks, so I'm going to enter my 8th month soon. So I'm nearing the end.
You had a prenatal doctor's visit this morning. How did that go?
Yeah, it was strange. So because of this situation and how quickly it's evolving, normally at this stage of pregnancy, I would be seeing my doctor every 2 weeks. This is my first visit in 4 weeks, so you can imagine that there's been a lot of sort of anxiety in between. Many of my questions my doctor still can't fully answer because it is sort of changing, but so far the expectation is that I will be able to deliver at the hospital that I'm registered at, which is St. Joseph's in Toronto. But I will only be able to have one support person there. And that's reassuring because one of my biggest fears is that I won't be allowed to have my husband with me. I'm sure anyone out there can imagine something so big and something so at times traumatizing. To do that by yourself, is a legitimate concern for a lot of pregnant women. So far, my doctor has indicated that I will be able to have one support person with me and that I will still be able to deliver in the hospital of my choice as planned. But usually in a couple of weeks, I would start seeing her every week, but we are scaled down to every 4 weeks.
Yeah, and just on that, I'm glad to hear that you're going to be able to have that one person in the delivery room with you. But I know that there are hospitals in the U.S. that are putting restrictions on that, and they're saying no one's going to be allowed in. And do you know what is the logic behind that and putting those restrictions in place?
Yeah, so in New York, which is the epicenter of the virus in the U.S. at the moment, the hospitals have indicated that women cannot have any support person there. And I have heard that there are hospitals in Toronto that are starting to indicate that that may happen to some of their patients. The reasoning behind that is just that mother and baby are really vulnerable in that moment and in that process. And so to minimize any risk of bringing the virus in, they lock down the unit and they allow the woman to give birth in a much more controlled and lower risk environment.
So you've been reporting on what it's like to be pregnant during this pandemic. Can you tell me a bit about the kind of research that you've been doing and the quality and the amount of information that's available right now on how COVID-19 can impact a pregnancy?
Yeah, so there have been a couple of early studies, one main study that's really what everyone's sort of relying on for their information. It's based on a very small sample from China, but we are starting to see, particularly from Europe, more cases of newborns being affected. So there are ongoing studies that are looking at that and how that's happening. And then I've just been speaking to doctors both here in Canada and in the US, obviously where things are rapidly progressing much more than over here, about what they're seeing, how they're dealing with patients, and what their protocols are as each stage of the virus affects their patients and their hospitals.
The data that's available right now, like you mentioned, it's a small sample from China, and it's mostly based on women in their third trimester, right? Like, we still don't know much about how COVID-19 affects pregnancy in the first and second trimester.
Yes, exactly. So those clinical trials were done on women in their third trimester who were close to delivery. Like I said, a lot of the fear and anxiety that women are experiencing in the early stages is coming from the fact that we simply don't know how this virus affects women in their first and second trimester, particularly the first trimester. Things like high fevers, prolonged fevers, they can have an impact. So I think that's certainly something to watch, and that those trials, I think, are happening. That research is happening, but we really don't know very much at all about how early pregnancy is affected by COVID-19.
So let's answer some basic questions that I'm sure a lot of people have. I know that being pregnant does change a woman's immune system, mostly so that the body doesn't attack the fetus and treat it like it's a foreign object. And it does put pregnant women at a higher risk for contracting transmissible diseases. So are pregnant women more likely to get infected with COVID-19?
So you're correct that pregnant women are more vulnerable to infection. They certainly are at a higher risk of becoming sick with a cold or sick with a flu, but there is no indication at the moment that they are more vulnerable to COVID-19 than the average person.
Okay, so are you supposed to take any precautions right now that are different from what the general population is being told to do?
At the moment, from Canadian doctors, the advice is the same to pregnant women as it is to any citizen, which is to wash your hands diligently, to maintain social distancing, to sort of minimize any unnecessary contact with people. But in London, for example, in the UK, they're asking pregnant women, they're considering them a vulnerable population and asking them to stay home in the same way that they're asking elderly people to stay home.
Infections and pregnancy are not a good combination in general, and that is why we've taken the very precautionary measure, whilst we try and find out more, to include pregnant women in the group alongside older women and people who've got pre-existing significant health conditions.
So, I would think that you would take as many precautions as you're comfortable with, but at the moment in Canada, the guidelines are the same for everyone, which is wash your hands, maintain social distancing, and limit your contact.
And what about complications? Are pregnant women more at risk of developing complications from COVID-19?
The indication thus far is, unlike SARS, where there were greater vulnerabilities for pregnant women, based on the clinical trials thus far, no, there is no greater complication for pregnant women in terms of pneumonia or respiratory disease.
There are still plenty of unknowns about COVID-19. While research is ongoing, the World Health Organization says there isn't any evidence at this time that pregnant women have a higher risk for severe illness.
But again, for women in their first and second trimester, there just isn't enough research to say whether or not an infected woman who is in her first and second trimester could develop complications because, in your first trimester in particular, you really are so vulnerable to so many things, including a high fever and a prolonged fever. So I think that one is a wait and see for sure.
And what do we know about the impact that COVID could have on the pregnancy itself? Is this anything like the Zika virus, which can cause certain birth defects? Has any research been done on that yet?
So that research is ongoing, but so far the indications are for women in their third trimester, it's not having the same type of impact on the fetus as something like Zika, which is really positive. However, many fertility clinics in this country and also in the US are stopping in vitro cycles. They're canceling fertility treatments. And I think certainly a part of that is the fact that we just don't know how COVID-19 can affect pregnancy in those developing stages, in those crucial first 12 weeks.
What about transmission? If a mom is infected with COVID-19, can the virus be transmitted from mother to baby?
Based on the clinical trials, there is no evidence that maternal infection can be transmitted from mother to fetus. That's really important.
The WHO says it's not yet known if the virus can be passed from mom to baby during pregnancy or delivery, but it hasn't been found in amniotic fluid or breast milk.
So that's really positive. You know, the concern is just that once you've delivered, that if you are infected, your close contact with baby can be passed on.
And we have heard of newborns and babies being infected with COVID. And what do we know about that? How do they do when they're infected?
Yeah, so the good news is that so far in instances of newborn infection where they think it's likely that that was through close contact, whether it was kissing or skin to skin or droplets, the outcomes have been quite hopeful. The cases have been promising, and despite the fact that babies do have weakened immune systems compared to the general population, there are no special precautions for babies at this time. So they're not asking babies to be isolated. They're not putting them in any special care after birth. And it seems that so far recovery has been in line with what we're seeing with children and younger people, which is mostly positive.
We know it's not common that children will get severe disease or even, get the infection, but we need to study it collectively to get enough numbers so that we can have accurate information as to who will really get sick.
We'll be right back. I want to talk a little bit about your experience. How have things changed with your healthcare? How has this pregnancy been different from your first pregnancy as a result of this pandemic?
It's been a completely different experience, and really my heart goes out to women who are doing this for the very first time, because I've been through this before very recently. I have very much almost the same sort of care structure as I had before. I have been able to sort of kick into just sort of robot mode and just, go with the flow. But if I was doing this for the first time, I would be terrified. So you have 2 ultrasounds in early pregnancy. One is to check for birth defects and Down syndrome around 12 weeks. And then around 18 to 20 weeks, you have what's called an anatomy scan, where they have a more sort of in-depth look at the baby to see if it's developing 2 arms, 2 legs, the head, the heart. They check, it's a very thorough ultrasound, and it's a very important one. And it's also a very special one because you really get to see this person that's forming in your body. And if you want to, you can find out if you're having a boy or a girl. So it can be a very emotional and special ultrasound. And I know many women are having that canceled or delayed, which means that if it's your first pregnancy, you're really in the dark. And to have the lack of information and the lack of research around how it's affecting you in those 2 early stages, I think would be terrifying. For me, birthing classes at St. Joseph's, I know, were canceled. There's also just a lot of other care that women may have throughout their pregnancy. So whether it's physiotherapy for different issues, acupuncture, massage. So, there is quite a big system of care around pregnant women that exists that has sort of fallen by the wayside. And my understanding is that women who are pregnant for the first time are just sort of figuring this out on their own as they go. Most of my appointments have been delayed. canceled or gone virtual. I finally got to see my doctor today after 4 weeks, which is, it's unnerving. Even having done this before, it's unnerving because I'm at a really critical time when I need to know how the baby is growing. I need to start preparing for my delivery plan based on those key indicators from my visits. And then another thing that's sort of a monkey in the wrench is that I was recently diagnosed with gestational diabetes. I've never had that diagnosis before. It wasn't present in my last pregnancy. And so normally at this point, I would have seen a specialist at St. Joe's. I would have had a meeting with a registered dietitian. I would have been walked through how to deal with this because it can be kind of scary. But all of those appointments have been moved to very quick phone calls. I've had to learn to monitor my blood glucose completely by myself. I spent most of yesterday morning pricking myself over and over and trying to figure out why, I couldn't get the test strip to work. I had a big cry about it. And I just, I felt very lonely and I felt very frustrated that this was happening to me with sort of no guidance and no care. And I know that it's small potatoes compared to what's happening, but any sort of deviation from the norm in pregnancy, it sets your heart racing. It makes you very nervous. And to just have to sort of be doing that in an isolation bubble is just really hard and it's exhausting. And so I can't imagine if there's women out there that are facing other complications and other high risk situations, how they're coping. And I know that pregnant women are not necessarily at a higher risk in terms of the virus itself. But I think what people don't understand is that it's a domino effect and it really does impact a lot of what our normal care would be. I'm sure, like many people, my instinct is not to burden my healthcare provider because I know that frontline workers are dealing with a lot. And so I'm just sucking it up, but it's hard. It is hard.
Yeah, I can't imagine that kind of stress and uncertainty. Can I ask, the delay in appointments, why are doctors postponing and delaying these appointments? Is it just because they're trying to not bring that many people into these healthcare facilities in person, or what's the reason?
That's right. Yeah. So my clinic is a downtown Toronto clinic. They service everyone. It's not a specialist clinic, so it's not an OBGYN. It was completely empty today. So it was one patient at a time. They've canceled all non-urgent appointments. They're all being done either by phone or being delayed until there's a greater understanding of how this is going to unfold. From my doctor, my understanding is that they're doing that so that they can limit patient interaction and how many people are in the offices and in the clinic and just keep the burden on the health system as low as possible outside of critical care.
So all of this stuff, all this concern about how this pandemic is burdening hospitals and healthcare workers and how strained they are right now, do you know if that's going to have an impact on you at all when it's time to deliver the baby?
I spoke to a mother who had given birth sort of during the peak of SARS in Toronto in 2003. And what she described, I think, is sort of similar to what we're now seeing happen in the US, particularly in New York and California. Many of the main hospitals were sort of being flagged as primary critical care. So some of those labor units were moved to other hospitals. She also described having to be in isolation, so she had no support partner. She gave birth in Scarborough. And so usually, you have your labor nurses, your maternity ward sort of staff, and then you have critical care and ICU and different wards. But in this instance, she described all of the doctors and nurses as having to share duties across the hospital, which just meant reduced sort of staffing and care for specific wards like maternity. So the care will likely look different. The protocols for who can come in with you and how long they can be there will likely look different. And I think women who are expecting in the next couple of months should anticipate that their birth plan is going to change, and it could likely change very, very quickly.
Yeah, I know there are a lot of women who are considering inductions. I saw last week a California hospital network started offering inductions to women at 39 weeks Is that something that you've considered? Is that something that women you've been talking to are considering?
Yeah, I just had that conversation with my doctor today about considering induction between 38 and 40 weeks. That's absolutely something that I would consider and I think makes sense. You know, if we're trying to manage how many people are coming into the ERs and into the hospital system, and if we can control to any degree when there's going to be a flood of people, or, you know, labor can happen at any point, but if you are able to sort of say, we'll bring you in on this day, on this week, to me, that would provide a lot of comfort personally. And so I'm certainly considering it. And I do know other women that are considering it that probably wouldn't have before.
What kinds of conversations are you having with your husband and your family right now? I guess I'm just curious, like after the baby is born, assuming that everything goes well, and, you know, I really hope it does, what are you thinking about having a baby during this pandemic? How do you think her life is going to be different?
I mean, I think about the plans that I had a month ago to take her to Halifax to see her paternal grandparents. I think about my plans to take her to the West Coast to see my dad for the first time, and to swim and to just be outside and to just have a peaceful, relaxing maternity leave, you know, and now all I can think about is getting through the delivery, getting her home safely, making sure that our household is set up so that she's not put at undue risk with extra people or visitors or any kind of possible risk of infection. And it's just such a dramatically different environment to bring a newborn into. You want it to be a time of joy and celebration and light. And it's hard not to feel grim right now. I've been thinking a lot about the idea of going back to normal and whether that is possible. I think when you look at just the ramifications of the mass unemployment, the staggering economic impacts, and then the fact that we're isolating and we could be social distancing for quite a long time. You know, my son is 2 and he hasn't seen or played with another 2-year-old in quite a long time for a 2-year-old. And I think that isolation will have an impact. I think that the kind of societal structures that are in play after we sort of come out of the health scare part of this will certainly have an impact on this generation because we've exposed a lot of inequalities. My children are not going to experience life the same way that I did. I don't know what that's going to look like. I don't know how it's going to impact this generation, but there's no way that it won't. And there's no way that they're not going to be formed and fueled by how this virus has impacted us as a society. But at the same time, you know, I also have a toddler, and I think you have to keep putting your energy into creating an environment that is loving and stress-free as much as possible for them, because, you know, kids, they suck all of that energy up and they respond to how you respond. So we're really just trying to stay positive and know that this too shall pass. I think a lot about the world that I'm having kids in, and I know there's a lot of conversation amongst millennials and other people my age, our age, about the morality and the ethics of having children right now, not just given this virus, but given climate change, given political friction, given the economy. But we continue to do so because we continue to believe in optimism and to believe in hope. And so that's just what I'm clinging to, is that we're certainly not the first generation to struggle with, am I bringing my kids into a good place? And so we're just sort of falling back on optimism. And I think, I don't know, you know, what choice do I have, really? At the end of the day, she's coming in 9 weeks, like it or not. So, yeah, we're just putting on a brave face.
Okay, Amil, thank you so much. I know it's a really scary time, but you sound hopeful, and I'm glad to hear that. And we wish you all the best with the rest of your pregnancy.
Thank you so much. I'm sorry I got so emotional there off the top. You don't think about it, and then somebody asks you, and then suddenly you just the floods open, and
yeah.
But at the end of the day, I am hopeful.
All right, that's the show. But before I let you go, I just want to make a quick note of a major update to how the federal government is helping small and medium-sized businesses that have been hit by the pandemic. Last week, Prime Minister Justin Trudeau announced a 10% wage subsidy to help businesses keep their employees. Today, he admitted that wasn't enough.
But it's becoming clear that we need to do more, much more. So we're bringing that percentage up to 75% for qualifying businesses. This means that people will continue to be paid even though their employer has had to slow down or stop its operations.
This 75% wage subsidy will be backdated to March 15th, and more information on that should come on Monday. And that's all for today. Thanks for listening. Wait, There's More is produced by Rachel Brown and me, Tamara Kandaker. Sound design and mixing is by Stephanie Werner with help from Rob Johnston. Our editorial assistant is Michael Furtado, and our executive producer is George Brown. I hope you all get a break from the news this weekend. Stay safe, and I'll talk to you on Monday.